One of the things we need to talk about constantly, of course, is cardiovascular disease, third most common cause of death in America. And it's not really changing up or down, but the new release, of course, from the FDA in the last couple of days has been trans fatty acids, the bad boys. It's not cholesterol, it's not saturated fat. And so suddenly now they're getting all into getting rid of trans fatty acids and heterocyclic-amines and acrylamides. Now, of course, I've been yelling about this since 1971. Of course, I published a paper in Acta Pathologica in 1971, which is a Danish international comparative pathology journal. The article is translated into 8 different languages. And, of course, the purpose of the article was I had done those 20,000 autopsies with the Center for the Biology of Natural Systems, an NIH project, 10 million chemistries, 10 million slides, looking for pollution as the problem. But it turns out every disease you can think of was caused by, where you died of natural causes, was caused by a nutritional deficiency, not pollution. One of the things I got to look at was compare arteries of vegetarian animals and people, vegan animals and people, meat-eating animals and people. What I found out was that vegan animals and people had the worst clogged arteries, not the meat-eaters, just the opposite of what you would think. And that's because even wheat germ oil and stored grains would oxidize after, a year or two in storage at room temperature. And the oxidized oils turn into trans fatty acids, heterocyclic-amines, and cause inflammatory injury to the lining of your arteries. And the arteries would respond with scar tissue, and those are the things that clog your arteries, not saturated fat and like butter and cream and lard and so forth. So what are we talking about here? Everything that your medical doctor has told you about cardiovascular disease is wrong. There's thousands of failed medical theories every century, and the 20th century and 21st century is no different. Let's look at some, of course. Congestive heart failure. Congestive heart failure, we've known for 300 years as a simple deficiency of a single vitamin and has nothing to do with cholesterol or saturated fat. It was discovered 300 years ago by a Japanese naval surgeon. I've had people who've on the heart transplant list with congestive heart failure in 5 days' time on the 90 essential nutrients, a little bit of extra, that secret sauce. They're off the heart transplant list. I didn't take them off. They didn't take themselves off. Their own doctor, their own cardiologist took them off. And then cardiomyopathy heart disease, the cause of sudden heart death in athletes and people who do hard physical work. Every year, 10,000 young athletes in America die of cardiomyopathy heart disease. I've done 1,700 autopsies on kids under the age of 10 in China, Qishan Province, China, in which they died of cardiomyopathy heart disease, a deficiency of a single mineral. And then coronary artery disease. This isn't caused by cholesterol or saturated fat. Coronary artery disease is caused by inflammation as a result of eating things like fried foods, processed meats, deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, spam, jerky, and then, of course, oils, olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils. And this is what caused the inflammation to cause coronary artery disease, not cholesterol, not saturated fat. And then, of course, thrombosis. This is one of my 8 lawsuits against the FDA in which I prevailed in federal court. We're talking about coronary thrombosis, where you get a blood clot in the coronary artery, or a thrombotic stroke, where you get a blood clot in the artery in the brain, or pulmonary embolism, where you get a blood clot in an artery in the lungs, or maybe deep vein thrombosis, where you get blood clots in your veins in your legs. That's all omega-3 essential fatty acid deficiency, or ratio problem between omega-3, 6s, and 9s. And then, of course, this all started. How did cholesterol and saturated fat get demonized when they're really not the bad boys? Well, it all started in 1901. A guy by the name of Ansel Keys, who was on the board of Procter & Gamble and the American Heart Association, got Procter & Gamble to give the American Heart Association $1.7 million to endorse Crisco, which was a diesel engine lubricant for German submarines, as a healthier food. And of course, they took the money and ran. And this whole thing, since 1901, has been about selling Crisco. The whole thing was a sales campaign, not science. There is no such thing as a Mediterranean diet that will save your cardiovascular system. That was all a sales campaign to sell Crisco. Get over it. Well, contact your longevity associate and ask for the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, my new DVD, Somebody Needs to Go to Jail, and my new CD, Public Enemy Number 1. And the book Epigenetics, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy Number 1, are kind of the 25-year update on Dead Doctors Don't Lie. They're not to replace Dead Doctors Don't Lie. They kind of pick up where Dead Doctors Don't Lie left off. But 25 years of research by myself and $100 billion worth of research by everybody else shows that, yep, I was correct in 1971 when I wrote the paper. And, of course, guess what? Everything, all the research today shows very clearly. And even the FDA sent out an email to every doctor saying, hey, stop giving prescriptions to lower cholesterol. Stop telling your patients to get off of cholesterol or cholesterol-restricted diets, because you'll increase your risk of type 2 diabetes by 52% and Alzheimer's disease by 100%. Don't do it. Epigenetics, the book. Somebody Needs to Go to Jail, the DVD, and Public Enemy Number on the CD. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
Do certain foods cause you to bloat or experience gas? Do you wake up in the middle of the night with heartburn? Are you forced to sleep on piles and piles of pillows to cut down on heartburn? Have you been diagnosed with acid reflux or gastroesophageal reflux disease? If any of these describes you, then you've got digestive problems. I was awakened with heartburn almost every night for over 20 years. Then I heard Dr. Wallach and realized all of the antacids I'd been using were actually part of the problem. My stomach acid wasn't too strong, it wasn't strong enough. So I started taking the ultimate enzymes from Longevity. Now all of the heartburn, belching, and bloating are gone, and I can sleep through the night without piling on the pillows. And I'm back to eating the spicy foods I love. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Virtually every sector of the economy has slowed to a snail's pace. Huge publicly traded companies are laying off thousands of employees. Believe it or not, even the government is letting people go. However, one business industry is thriving, and that's healthcare. Pharmaceutical and health insurance companies are posting record profits in a near-depression economy. Americans are sicker than ever, and those companies are profiting like never before. You too can get involved in healthcare for just a one-time sign-up fee. Longevity is building an army of associates dedicated to saving America. Dr. Joel Wallach has educated thousands of people on the concept of do-it-yourself healthcare. With a little education, much of what is done in a doctor's office can be done simply and safely at home. Join Longevity and help save America. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Longevity has developed the perfect supplement in SmartFX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try SmartFX from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the pig pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about weight gain and obesity, as I've got a news story here from Fox News headline, mushroom extract may help treat obesity, but it's no cure. Say mushroom used in traditional Chinese medicine may help treat obesity by altering the composition of bacteria in the gut, according to a new study in mice. This study, researchers found that mice that were fed a high-fat diet along with an extract made from the mushroom called Ganoderma lucidum, or Lingzhi, for 2 months gained less weight than mice that were fed the same diet without the extract. according to one of the lead researchers, a Dr. John D. Young of Changgun University in Taiwan, says, quote, given the good safety records of Lingzhi and the fact that it is similar in composition to other mushrooms that we consume regularly, Lingzhi may be considered by the general population to be a convenient strategy to lose weight, along with other known approaches such as calorie restriction, exercise, and a healthy lifestyle. And according to Dr. Monica Engwall, a cardiologist and diet expert at Mercy Medical Center in Baltimore, said it's too early to tell whether the mushroom will work in humans the same as it works in mice. Quote, I think it's interesting. I think there are some possibilities, but you can't say that because it works in a mouse, it's going to work for sure in a human. And I always like to point out when we have people saying this kind of stuff, there's not a drug on the planet that was approved by the FDA that wasn't used in animals, usually mice, before it was done with human trials. So, that hoo-ha about, oh, well, it's nutrition, so it may not work the same, in animals as it does in humans, just doesn't fly in my book. And they go on to say they found that the molecules that they isolated in the mushroom were altered. The composition of the gut bacteria in the mice that were fed the high-fat diet after consuming the extract, the mice's community of gut bacteria resembled that of lean mice. And they say rather than the gut bacteria of the mice that were fed the high diet with the high-fat diet, that is, with no extract. They go on to say previous research in mice has shown that changes in the composition of gut bacteria may be related to the development of obesity and metabolic disorders. And this is where they got gross. They actually fed the feces from the mice. So they got the extract to the mice that didn't get the extract, and it changed their bacteria too. So there you go.
Well, this is what they're doing in human medicine now. They're taking feces, human poop from one person, giving it to other people, either by mouth or by enema, to try and introduce probiotics. I mean, medical doctors have been laughing at the alternative health community for hundreds of years over this probiotic stuff. But once they got the idea, they're going to use real human poop instead of normal bacteria, cultures by themselves. Doctors are insane. Okay. Also, we know that being overweight and obese is due to a deficiency of nutrients. Has nothing to do with lack of exercise or eating too much. And so to keep hanging on to that failed medical theory is like saying, we really know the earth is flat. We really know that the sun goes around the earth. We really know that diseases are caused by evil spirits, and all this new stuff is just nonsense. And so hanging on to this exercise and eating too much, lack of exercise and eating too much as a cause of obesity is insane. It's a failed theory. Following that theory for 25 years in preventive programs, more exercise, less eating. For treatment programs, more exercise, less eating. We became the number one obese nation in the world. So I want people to get a hold of that book, Hell's Kitchen, The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And wouldn't hurt to throw in the CD by the same title, Hell's Kitchen. Thank you, Doug. And we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages.
Let's head to Michigan. And Dave, you're on with Dr. Wallach.
Hello, Dave. You're on the air.
Hi, Doc. This is Dave in the Thumb, Team Wallach's Way. I just got to thank you for leading us out of the insanity.
Okay, thanks. What's up, sir?
So, I had a young gal of 76, pretty spry gal, call me about her granddaughter, 17. She's an athlete, and she was just diagnosed with a positional orthostatic tachycardia syndrome. That one's a little above my pay grade, so I thought I better call the expert.
Okay. Now, when you say positional, that means if she's bending over, she's on her toes reaching up, or standing and twisting behind her, it's going to send off, you said tachycardia, right?
That's right.
Fast heart rate. And, of course, this is a very simple thing, actually. Shar, are you there?
I'm here.
Yeah, this is a Shar thing. What would you say about somebody whose heart beats real fast when they get in a different position?
They actually have osteoporosis. Their vertebrae has lost all its cartilage, and the nerve that controls your heartbeat, it goes through your backbone someplace there, and it's being squeezed, and that's what causes the irregular heartbeat.
Yeah, fast heart rate, irregular heart rate, and there's a name for that. What would you call it?
I call it a glucogel deficiency.
Okay, what about AFib, atrial fibrillation?
Yeah.
Yeah, sometimes it'll be ventricular tachycardia, which is the bottom half of the heart getting fast, but you got it exactly right. And so, Dave, what does this gal weigh, this 17-year-old? Have any idea?
Yeah, she's about 100 pounds.
Okay, 100 pounds and athletic,
Yep.
right? Okay, so let's have her take, as Shar said, let's have her take one of the healthy bone and joint packs per month. Have her get an extra bottle of Osteo, an extra bottle of glucogel. I want her to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 a day, so it'll be 1 scoop at breakfast, 1 scoop at dinner time. The 3 EFA Pluses, she can have 1 at breakfast, 1 at lunch, 1 at dinner. And then the glucogel, have her take 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner time. And Char's exactly right. What happens is, and this has nothing to do with age, although doctors might say it's genetic or has something to do with age or autoimmune, but basically this is just simple nutritional deficiencies. And I'd have her take, and stay away from gluten, wheat, barley, rye, and oats, fried foods, processed meats, and oils. And this will help support maintenance repair of her disc, make the disc fatter, push the vertebrae apart, take the pressure off the roots of those spinal nerves, and her heart will come right. We'll be back after these messages.
Let's head to Kansas City, Missouri, and Lisa, you're on with Dr. Wallach.
Lisa, you're on the air.
Hey, good afternoon, Dr. Wallach. I'm calling about prolonged and irregular menstrual cycles for a woman 54 years of age.
Okay.
And what causes it?
Sure. Okay, well, menstrual problems, regardless of age, is called dysmenorrhea, okay, like disturbed menstrual period, dysmenorrhea. And dysmenorrhea is caused by not enough nutrition for the ovaries to make all the hormones it needs to make, the estrogen, the progesterone, and for all the muscles in the uterus to work properly and everything to work properly and in synchrony. And it's called dysmenorrhea. Sometimes the periods will last 10 days instead of 3 or 5 days. Sometimes there's more pain and heavier bleeding, and sometimes you might go 3 or 4 months, even at age 40, 50, you might go 3 or 4 months without a period, and then suddenly it appears again. And so all this has to do with nutrition. Now, do you have any history, Lisa, of skin problems, any eczema, dermatitis, or psoriasis?
No.
Do you have any history of asthma or bronchitis?
Yes.
Okay, as a child or as an adult or both? Or
As a child.
Okay.
Asthma.
Okay, now do you have children?
Yes.
And do any of them have asthma or skin problems?
Yes, my baby does.
Okay, how old's the baby?
She's, the baby's now, she's 19 years old.
Mm-hmm. Okay, well, here's what's going on. You have passed on to your children what's called a gluten intolerance. It's not a genetic thing, but it happens through cord blood and through breast milk. And the gluten intolerance causes malabsorption of nutrients. So this nutritional deficiency you've had and passed on to your kids is a secondary to gluten intolerance. So, Shar, are you there?
I'm here.
Okay, what would you do for Lisa here?
She needs to get on a gluten-free diet right away.
Okay. No wheat, no barley, no rye, no oats. What else?
And I would get her on a Healthy Start Pack, but I would also give her, for the female problems, Women's FX and Xerafem.
And Xerafem. Very, very good. Okay, Char's exactly correct here, Lisa. And so I'd have you get rid of all the bad stuff. As Char says, no gluten, no wheat, no barley, no rye, no oats. That includes dog food, cat food, mother-in-law, man in the house, kids. Everybody's got to be gluten-free because of prevent cross-contamination. Then there can be no processed meats with nitrates, nitrites, no deli slices, sandwich meats, no oils, no olive oil, coconut oil, margarine, mayonnaise, sodas, and cooking oils. No gluten, again, no wheat, no barley, no rye, no oats, and that's everybody. And then she weighs 100 pounds, or what do you weigh? What do you weigh?
About 160.
150? Okay, you weigh 150. And so I'd go ahead and hang on. We'll give you your formula here after these messages. We'll be right back with you, Lisa, after these messages. Okay, Doug, let's go back to Missouri. And Lisa, kind of finishing up here, we're going to give you a program for yourself, and you can pass this on to your kids, including your daughter. For yourself, at 150 pounds, I would have you take 2 of the Healthy Start packs per month. There'd be a full dose of each of the products in there at breakfast and dinner. I would also have you take the Woman's FX, 2 ounces a day. It comes in quarts of liquid, 2 ounces a day, ounce at breakfast, ounce at dinner. It's a 150-year-old blend of herbs that actually is obviously 150 years old. You're talking about is very well tried, very famous, works like a charm to help support healthy function of the female systems, and the dysmenorrhea, amenorrhea, which there's no periods, and menopausal symptoms, PMS, and then, of course, our new product, I'd throw 3 of those in twice a day until the symptoms go away. It's called Xerafem, Xerafem. After the symptoms go away, I'd cut that to, say, 2 tablets twice a day instead of 3 twice a day for actually really speeding up the healing process. Okay, Doug, let's go to callers.
All right, let's head to Ireland. And Michael, you're on with Dr. Wallach.
Okay, Michael, you're on the air.
Hi, Dr. Wallach. A few weeks ago, one morning, I ate a mixture of cloves, ginger, cardamom seeds, red and green peppercorns on an empty stomach. And about 3 hours later, when I went to the toilet and before flushing, I noticed 4 items or 4 things floating on the water, quite buoyantly on top of the water. I fished one out and flushed the rest. And when I came back to it the next day, I had to do so. I didn't have time that night. I came back the next day, it had gone completely flat. Previously, it had been inflated. It was like a little inflated kind of football. The next day, it was completely flat, and which I still have one of them. I still have that one, and the dimensions are, it's about an inch long. It's 3-sided. It's about an inch long, half an inch in depth, and a salient feature is there's like a connector coming out of, say, 1 o'clock.
Yeah. Here's what you need to do. It's a great description, but here's what you need to do here, Michael. You need to have somebody with a microscope look at this under the microscope, put some stains on it, like methyl blue or some coloring, which would identify some kind of structure. And that we can tell if it's a parasite, you can tell if it's a piece of potato, and so forth. When you have things come through that are whole, as opposed to just like custard, okay, which shows digestion, you could have a digestion problem, you could have a gluten intolerance, you could have all kinds of stuff. It would be useful to look at whatever you've saved out of the toilet, look at it under the microscope and get some sense what it is. You'll have to have them use some dye on it. Again, methylene blue is a good one. What do you personally have in the way of history? Do you have any bowel problems, any bloating or diarrhea or constipation problems?
No.
Okay, so you're never diagnosed with irritable bowel syndrome or Crohn's disease, anything like that?
Oh, no.
Okay. Do you ever have any asthma or bronchitis as a kid or an adult?
No.
Okay. Well, tell me about your skin. Do you have any dry, rough skin, any eczema, dermatitis, psoriasis, or rosacea, like real pink, red cheeks or anything?
Yeah, I've had eczema before.
Okay. What do you weigh, sir?
145, I think.
You're 145 pounds. Okay. Let's see here. Shar, what's Michael's problem?
I think he probably has a gluten intolerance.
Yeah, with eczema and some digestive problems, he's definitely got a gluten problem. Exactly right. 145 pounds. He needs a basic program here, and, of course, he needs a diet. What kind of diet would you put him on?
A gluten-free diet, obviously.
Well, there you go. No fried foods, no processed meats, no oils, no gluten, no wheat, barley, rye, and oats. That means no rye whiskey, no scotch, no bourbon, no beer unless it's made with rice or is certified gluten-free. Red wine is okay, but definitely no fried foods, no processed meats, no oils, no gluten. And then, what would you give him as a supplement program, Char, just because he does have some digestive disturbances?
I would get him on to the healthy digestion packs.
Okay, there you go. 2 healthy digestive packs. Take a full dose of everything twice a day. And I would take 2 of those ultimate enzymes that come with the packs. Take 2 of those ultimate enzymes, say 2 to 3 minutes before each meal with a couple ounces of water. Wouldn't hurt also to order a couple of our bottles of our peppermint oil. Put 4 to 6 drops of the peppermint oil in some mint tea or peppermint tea and sip on that throughout the meal, and that's going to help with all these problems. And then give us a call after you find out what this stuff is you've collected out of the toilet. Somebody needs to look at it with a microscope and look and put some dye on it so you can see some structure. Okay, Doug, let's go to callers.
Let's go to Arlington, Texas, and Gina, you're on with Dr. Wallach.
Oh, Gina, you're on the air.
Dr. Wallach, it's an honor, first of all.
Thank you. You're very kind.
About 3 months ago, I went and had some blood work done, and I had just started on the Healthy Start Pack. I'm currently on the liver cleanse. When I got my blood work back, I was low in iron, vitamin B and D, and my testosterone was low. When I started with the Healthy Start Pack, I started feeling better, a lot better, but I'm still feeling real exhausted. And I don't know, I'm thinking that it's my iron. I haven't taken anything other than the Healthy Start Pack. And so I needed to know if there's something else.
Wait a minute. Have you changed your diet at all?
I have. I'm eating, I've gone to gluten-free because I had a lot of stomach, belly weight. And so I'm actually transitioning my whole my husband and my son as well, gluten-free.
Okay, what do you weigh? What do you weigh?
I weigh 175. I am the heaviest I've ever been in my entire life.
How tall are you?
I'm 5'4".
Okay. Yeah, I'd say at 5'4", you need to be like 135, 140, maybe 135. I think it'd be better. So maybe you need to lose 30, 40 pounds kind of thing. And let's see here, because you're exhausted, your hormones are a little bit low, you have low iron. Are you a vegetarian?
No, sir.
Okay, you do eat red meat and liver and that kind of stuff?
Not liver, and I've been craving red meat, so I am eating red meat more.
Okay, good. Yeah, well, if you're iron deficient, that makes sense, doesn't it? Okay, Char, what program would you put Gina on?
Boy,
Go heavy.
I guess she needs to get on the health. Well, she needs to get on 2 Healthy Start Packs, but she needs to take the ASAP for the weight loss.
Okay, well, hang on, Gina. We'll be back, and we'll lay out a program for you after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life. And let's see here, Douglas, go back to Texas and Gina. Okay, as Shar said, here at 175 pounds, I'd go with 2 Healthy Start Packs per month. That'll be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 Healthy Start Packs per month. And also go ahead and throw in 3 of our Ultimate Selenium twice a day, 3 at breakfast, 3 at dinner. That's 2 bottles a month. For the cofactors in there that actually are very, very good for making red blood cells. And when you have low iron, you need more of these cofactors to actually get the iron even that you have to work properly. And so it'll be 3 of the selenium twice a day. That's 2 bottles a month. Then, because your testosterone is low, okay, I would go ahead and also take the Zerofem. Go ahead and throw in the Zerofem, and this is going to help support healthy hormonal production and balance and everything. Take 3 of those twice a day, and you're going to find that your energies are going to come up. And as Char said, for the weight loss, I'd go ahead and get 1 bottle a month of the ASAP. Put a dropper full under your tongue 30 minutes before each meal. Let it absorb through your oral tissues. If you swallow it, it won't hurt you, but you won't get maximum benefit. And so put the dropper full, not a drop, but a dropper full under your tongue 30 minutes before each of the 3 meals. 1 bottle a month will pull this off. Let it absorb through your oral tissues. And then call us every couple of weeks if you would. Let us know how your energy levels are going. And if, you can get our Java Fit coffee. You can get our Rebound Sports Drinks, which has 100 nutrients in it. And give us a call every couple of weeks, and we'll walk you through this. Sounds pretty straightforward. Okay, Doug, how much time we got here?
About 2.5 minutes.
Okay, let's try a quick one.
All right, let's head to Virginia. And Steve, you're on with Dr. Wallach.
Steve, you're on the air.
Thank you very much. I had a question about our friend. She has a ringing of the ear, I think, on the one side, and she said she feels from the skull halfway down to the oral area. She, feels affected by that.
Okay. The ringing in the ear is called tinnitus. It's actually caused by a squeezing of the auditory branch of the eighth cranial nerve. And what does your friend weigh here, Steve?
I believe 93 pounds, estimating there.
And how old is she? Is she an older woman or?
Early 50s.
Okay, 93 pounds, early 50s. Okay, Char, what would you give her for tinnitus ringing in the ears? 93 pounds, say for 100 pounds.
Healthy bone and joint pack.
Okay, and what would you do for her ear directly?
I would put CM cream down the ear very carefully, and that'll stop the ringing for a while until the glucogel will actually fix the problem, but she needs to use the CM cream temporarily to get rid of the ringing.
There you go. And, of course, we have people who had tinnitus ringing in the ear for 25 years, and in 10 minutes' time, they used, as Char said, put that CM cream down, like a half a teaspoon down in her ears with a Q-tip every morning, and she'll get relief within 10 to 30 minutes, and after 3 or 4 hours, it'll gradually come back. So she may have to do it 2 or 3 times a day. But I'd go ahead and get her one healthy bone and joint pack, get her an extra bottle of the CM cream, get her an extra bottle of the osteo, so she can take 1 ounce of osteo twice a day, 1 scoop of the Beyond Tangerine at breakfast and dinner, the 3 EFA pluses, 1 at breakfast, lunch, and dinner, and then, of course, the 1 bottle of glucogel. I'd go ahead and have her take 3 of those twice a day. Let's start there. And none of the bad stuff, no fried foods, no processed meats, no oils, no gluten. And give us a call every couple of weeks, Steve. Let us know how your friend is doing when it comes to ringing in the ears. But she should get temporary relief, as Char says, very quickly by putting the CM cream down her ear with a Q-tip, and because that'll relieve the inflammation and the pressure around the roots of the auditory branch of the eighth cranial nerve. It's caused by osteoporosis of the skull. Okay, but it is reversible. That's the good news. Okay, we only have a moment left here, and I'm going to go ahead and take it. Remind everybody about my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, my new DVD, Somebody Needs to Go to Jail, my new CD, Public Enemy #1, Educate Yourself and help your loved ones. And thank you so much, Char. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
You may have heard about the 90 essential nutrients or the Mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Longevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine Vitamin and Plant-Derived Mineral Complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Longevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.